Good afternoon, everyone. Welcome to our first afternoon session for the Inform Canada Symposium. And I'm here today with a great team of people from Seniors Newfoundland who are going to talk to us about supporting seniors through information and referral. And Seniors Newfoundland is dedicated to supporting the independence and well-being of older adults throughout the province of Newfoundland and Labrador. The mandate of Seniors Newfoundland is accomplished through outreach and partnerships with older adults, family members, volunteers, seniors groups, organizations, businesses, communities, INR organizations, and all levels of government. And today we have with us Kimberly Leonard, Meg Viz, Susan Roche, Trudy Marshall, and Yvonne Jacobs. So welcome to you all, and take it away.
Good day. My name is Trudy. I'm working with SeniorsNL. I'm the Resource Management Coordinator. And today we're speaking about supporting seniors with information and referral. Next slide. So now I'm not seeing the next slide. Okay. We're going to talk today as a panel. The first person speaking is Yvonne Jacobs. She's a peer support volunteer. And Meg Viz is coordinator of programs and services. I'm involved with resource management. And we also have as support our CEO, SeniorsNL, and also Susan Roche, who's doing our slides, and she's the data resource specialist. Next slide. So Yvonne will talk about where we came from, and that is where the Seniors Information Line began. It's really going to be about seniors helping seniors. Meg will talk about where we are now, talking about service and statistics, past the present, seniors, talking about the SeniorsNL information referral service. And I'll talk about our specialized INR database. It's for 50 plus. The services are there are for people who are 50 plus who identify as being a senior. We'll also talk about our involvement with Inform Canada and Inform USA, and also other partnerships like 211 NL and Find Help. And we'll talk about a new program we have called Social Prescribing. So SeniorsNL is a provincial not-for-profit organization. We were established in 1990. We were formerly known as Seniors Resource Center Association of Newfoundland and Labrador. Our mission is to support, promote, and enhance the independence and well-being of older adults living in Newfoundland and Labrador. And our mandate is number one, information referral to support informed decision-making for seniors. So that is information referral is our core service. We also facilitate the development and implementation of programs. Meg will talk about one of these programs, and I'll refer to the social prescribing later. We also work to influence policies that affect older adults as well. So Yvonne provided information referral and support to seniors both as a volunteer and staff. That's since the inception of the Seniors Resource Center Association of Newfoundland and Labrador in 1990. So we open doors for you.
I was lucky enough to be in on the very beginning of the Seniors Resource Center as it was then. And that's when the federal government realized that there's a large number of seniors in the population, and that they developed the Seniors Independence Program to assist growing populations of the seniors. And Newfoundland received 3 years of funding to set up 3 seniors resource centers to provide seniors with easy access to the types of information they might need to lead healthy and independent lives. The Marystown Centre was set up in a town shopping mall, which provided easy access for seniors who were out shopping, and they could just drop in if they have any questions or needed any information. And this was an area that had a high poor literacy rate. So seniors who had problems there didn't feel embarrassed by technology like today. When the 3-year funding ended, the mall allowed them to keep the office space free of charge for about a year. And the two coordinators, Mike Pickett and Stella Hollett, continued as volunteers. And in fact, when the space was no longer available, Stella continued to work from home, providing information and helping seniors in any way she could, in person or using her own phone. In contrast, the centre in Gander found that they were mostly providing information for social workers and other health providers who suddenly found out that they were not knowledgeable about seniors' needs. And the Gander District Continued Care Programme funded them after the funding raided, when the funding was there. And then the centre closed when the Community Service Board took over. The Health and Community Services took over. The St. John's Centre was also in an office building, which happened to be in the same building as the Old Age Security Office. And the staff were very helpful with information and spreading the word about Seniors Resource Centre and the toll-free information line. When the federal funding ended, through endless and varied fundraising efforts, the St. John's Centre stayed open in the same office space after that. In fact, we've moved 3 times since then. Money was scarce, as it always is, but Rosemary Lester, then program manager and later executive director, fought very hard to keep the toll-free information line, even when it meant that when she and the office manager were laid off, they came in and answered the phone, as they felt that the toll-free line was essential for seniors needing information and assistance. And it also set the Seniors Resource Centre apart as a provincial organisation. Next slide, please. From very early on, seniors volunteered to answer the toll-free line and provide information to seniors who called or dropped in. Often callers would comment on how relieved they were to have a real, live person answering the phone. Best of all, a senior who could understand the senior's needs and problems. And also, we had people calling from family and friends, and the volunteers could give a senior's perspective about the problems they were concerned with. Most important role for senior volunteers to offer is a listening ear and offer follow-up. When a senior has someone to talk to who really listens to their concerns, sometimes by the end of the conversation, the senior will have sorted out what to do for themselves, and they'll say, "Thank you for listening." From the calls, we are hearing about seniors' needs and wants and provided information about services and resources where they existed at that time. Most rural areas had seniors clubs there, one result of the forced relocation of communities. But in St. John's in particular, loneliness and lack of physical activities for seniors and also transportation were particular issues. As there were few programs for seniors back in early 1990s, just cards and bingo, Rosemary Lester, then project coordinator, met with interested seniors and helped them to organise their own Friday Friendship Club with guest speakers, mall walkers, many other programs, but those 2 programs had taxi transportation arranged through the Seniors Resource Centre, but at a minimal cost to the seniors. Later, the Friday Friendship Club itself obtained funding for a seniors grocery bus program. Many other programs were developed, and so the information line became very busy with inquiries about what does the Seniors Resource Centre offer, as well as calls about finances, drug cards, and we're still waiting for a national pharmacare program now to fill in the gaps. Other questions were about accommodation, luckily not homelessness at that time, home repairs, access to home care, long-term care concerns, and elder abuse, among other things. Next slide, please. Now I'm going to talk about the seniors guide first, because the seniors on the information line needed information in order that they could help others. So I gathered information from everywhere, and at that time I had to go and pick it up myself and find out, and that way I made contacts with the different organizations. So I got the information available on the front desk, but we really felt that other people needed to have that information. And so I compiled it all into a seniors guide for services and programs in Newfoundland and Labrador. And ours was the only province that didn't have one of these. Some of them in the other provinces had adverts that paid for it. But we approached the government and asked if they could print it since we didn't have one. And thankfully they did. So, of course, everything has to changes. Governments change their headings so that I don't know how many papers they must have shredded after they printed their one heading and then had got another change of name. So we had to send that out or just inform people, and then we had to update and revise completely. Several years we did that. Now today, of course, at the click of a computer, you can change the information and don't worry about all the wasted paper. In addition to answering the phone, volunteers also passed on information to others in the community. So word of mouth was a very good way of passing on information. Along the time, as time went on, we became aware that some situations the volunteers had to deal with were causing some anxiety, like the mental health problems. And we were very thankful when finally a mental health crisis line was put in. So we applied for funding to provide a program to help enhance the skills of our volunteers and dealing with stressful and difficult situations. So in 1994, we got funding to start what became known as the peer advocate volunteers, and now they're called peer support volunteers. We offered the program to information line volunteers first, and also seniors who were volunteers phoning the members of the Friday Friendship and the Mall Walkers Club to let them know what time the taxis would pick them up. And they found that talking to the seniors, when they made that call, they heard a lot of the problems that people had. And so it needed information too. And later, with more funding, the program was expanded and provided seniors anywhere in the province who expressed an interest. And of course, we had to have extra money for travel. Next slide, please. Now, the training program, which I do not call a training program, because it's an information sharing session, because seniors have so much knowledge and information that they need to share and be a part of it. So, and also one of the settlements I went, rural areas I went down to, when I said training, they said, we don't need training. They had enough of training with the COD moratorium. And in that particular community, 25 people were trained as hairdressers. A very small community of about 200 people. So that's why it's called information sharing sessions. So in 1994, we had the funding for this, and I partnered with Jane Dempster, who was a social worker at the Munn University School of Social Work, and we developed a program. And Jane's expertise was in the area of listening skills, communication, how to approach people needing help. And I developed the health-related topics and developed more materials about services and resource centres. Now, the recruitment, although it says it in session 1, in the local area, we had our audience. And with the when we went into the rural areas, the recruitment sessions began with me contacting local nurses, social workers, and also in the media, inviting seniors to learn more about services and resources. The sessions were held weekly or over 2 days or even monthly, depending on the group, and also the travel distance for me. I should mention here that the seniors guides were printed when we had some of these programs going, and the interaction between the seniors and what they were doing before we even went there to help provide information. The Minister of Health at the time agreed to print the program, the guide, and she is now the Lieutenant Governor of Newfoundland and Labrador. Next slide, please. We reached 29 communities province-wide by 2009. Oh, I should go back a bit to say about a little bit more about the program. With the aging changes, that is what it was: hearing loss, vision deterioration, losses, bereavement, and so those were all included there. But what I usually started with the program was, does everybody hear me? I'm sure you've been to places where they say, can you all hear me? And everybody says yes, and then the person drops their voice to much lower volume. So in this case, there was always somebody who said, I can't hear, or their wife said, oh, he can hear when he wants to. And I took with me information from the Hard of Hearing Association, and one of those gadgets that I took was a one-on-one communicator, which just has headphones and a microphone. So I had persuade the person with hearing loss to try it, and everybody watched. He heard for the first time clearly what people were saying. His face would light up, and that was a good way of passing on information about what is helpful and available. I also took things from CNIB and their gadgets too, and information about other organizations that can help. The access to services was, how to access it. The different things, the complications that you have when you're doing that. The barriers to getting at information and services, and the barriers that seniors themselves put up because they have had bad experience with that before. And then the information referral process, that was really about active listening, and we had a role play to do that, and a good listener and a bad listener. And then the couple would change over, and they really could understand what it's like when somebody ignores what the person is telling. They were just telling things about making a cake or something like that, and the other one would drum their fingers and look totally bored. And that got across the session about the importance of listening skills. So those were the things we concentrated most on those sessions. And as I say, they were spaced out a month, whatever, 2 in a day or a week or more apart. And okay, go to map now. So I visited all those communities, and we I had to group them for economy of travel. And sometimes things would be, the weather would mean that we had to cancel one end or the other, or there was illness in the community or a funeral. And what I arranged the meetings by was phone, because we didn't have, hardly anybody had email. Later on they did, but not then. And so I might have one contact in the community, which wonderful, they would tell everybody else, but in other places I had to phone everybody. And if I was going to 3 places at the same visit area, that was a lot of phone calls and juggling. But it was a wonderful experience. So we reached 29 communities. Some became peer advocates and were pleased with the titles. And one of those was Stella, who I mentioned with the Marystown, when she was a staff person there at the beginning. And she became a peer advocate, and she said it was so wonderful because when she called organizations, she could say, I'm a peer advocate with the Seniors Resource Centre. And she felt that gave her a bit more clout. Some just passed on information. They didn't want anything too formal, and they would absorb what we were sending them and pass it out as they saw fit. And some became friends, SeniorsNL friends, giving out the toll-free phone number. Okay, the next one, please. So there was changes from my way of doing things to the modern way of doing things. We had handwritten forms, which the peer advocates wrote their notes on, particular forms, and they kept their own binder, which was stored in a locked cupboard. They kept the incomplete, the ones that they wanted to follow up people, so they kept those so that next week they came in, they could contact that person. So from that, the handwritten forms, we went to computerized forms. From a senior's guide to the massive iCarol resource database that we now have, thanks to Trudy. From time-consuming, and I tell you it was, manually entering referral information on a spreadsheet to iCarol statistics, which just seemed to pop right up with no effort, at least not on my part. That gives you a brief overview of the past of the SeniorsNL, and so the next slide I introduce Meg, who will take you into the modern Seniors Resource Centre. She's the current Programme and Service Coordinator at SeniorsNL. As part of her role, she trains and supports staff and volunteers, the peer support volunteers, who respond to information and referral inquiries. Meg started us with as a support herself with INR in 2017. You're muted.
Meg, I think you might be muted.
Hear me now?
Yes, thank you.
Okay, thanks. Thank you, Yvonne. That was great. Thoroughly enjoyed that. Okay, I'm just gonna pop up to the top and give me 1 second. So I would like to start talking about volunteers first as a good segue with regards to what Yvonne was talking about, because the reality of peer support volunteers in general for us, is that it is because they are the reason we can do what we do, how we do it, when we do it, and for as long as we've been doing it. We are largely a volunteer organization with some staff that are supporting all of that. Today, we have 7 active volunteers who, quote unquote, man the phone line, but also everything that comes into us from every other channel as well, which we'll talk about. And we're in the process of recruiting another 3 right now. We're set up for half-day shifts, Monday to Friday. And because the majority of our inquiries come in by phone and or electronically, which we can share with everybody, volunteers do have an option to work from home or the office. We like having them in the office because there's a lot of learning that goes back and forth, but that option is there. As peer support volunteers, seniors helping seniors, it comes as no surprise that that all of them, our peer support volunteers, are over the age of 50, and the average age is 71. Our oldest volunteer is a woman named Lorraine. She's been with the organization since the beginning in 1990, and is still an active volunteer with us today. She was the last picture that you were looking at, and she turned 91 this year, but you would never know it. When we converted to iCarol, we created a training model that was suited to help volunteers and staff. And as a result, everybody has adapted very well to our conversion online to iCarol. Change the slide, please. Over the years, we have seen some pretty significant shifts in our information and referral services. The volume of calls that we receive have increased significantly over the past 34 years. There is a chart later on we're going to walk you through to illustrate this. The types of callers we do consistently continue to hear from seniors, their families and friends, as well as other agencies and community organizations. Increasingly, though, it's diversifying. There is now, I know in Yvonne's days, the health professionals were obviously heavily involved. in that as well. We continue to hear from health professionals inside and outside of primary care facilities. We're in the middle of a housing crisis that has been very challenging for everyone. So as a result of that, we've started receiving housing related calls from landlords worried about seniors that they are evicting, for example, and management of apartment buildings who know that they have some seniors who maybe they haven't seen in a while and they're a little bit concerned, and can we follow up? Also in Newfoundland, we have something called personal care homes, which is a private opportunity to receive some personal care. And often we will hear from social workers who work in those buildings and are reaching out about specific seniors. We also have heard from municipal employees for example, the City of St. John's, who might be worried about people who are renting from their not-for-profit housing, as well as knowing that there are homeowners who are not keeping up with their municipal taxes, and they will ask us to follow up on that as well, out of concern for the seniors, not to get the money. And we'll often hear from members of the House of Assembly, the provincial members of the House of Assembly, and federal MPs' offices in the province who are trying to help individual seniors who have reached out to them, and then they'll reach out to us to access our resources. In terms of geography, the inquirers have expanded pretty significantly beyond our shores. So for whoever doesn't know about Newfoundland and Labrador, we're an island in the middle of the North Atlantic. So provincially, we've always, as Lorraine indicated, gone around the province as much as we can. But more and more family members are living away, and as this population ages, part of the reason is because the youth are moving away to some extent. They're somewhere else globally, reaching back into the province, looking for resources to help their aging parents who are on the ground here. So we very frequently hear from family members and friends and siblings of these people. These people are also looking for emotional support for themselves when we have these conversations, because of the changes that are happening that they are not physically on the ground to be able to help with. So in many ways, we're helpful through that. And during COVID, we were accessing significantly more national resources as well. In terms of the types of requests that we get, they're getting a little more complex. Still pretty much a lot of what we have had, lots of usual suspects. But what's really happening is that there's a layering of needs that are coming in on our calls. So it used to be, a single thing that I might need that I'll call about, like my prescriptions or something. But now the needs are starting to layer. So someone who is calling, and this is the importance of listening and asking questions at the beginning of a conversation to understand, because sometimes people don't know exactly what it is they need, but through that conversation, we'll find out. So somebody might be calling for a food hamper, but then you start to get a little curious, because potentially that means obviously they don't have enough money. You'll talk about their federal pensions. Then you find out that their power is going to be turned off. And now we know we have a significant financial situation where this is going to take us into another realm with them, and that they're soon to be evicted, which takes us into another realm. So there's times where it's a very simple conversation. There are times where there's a layering of needs, and this is becoming more common. And really, most of this is happening due to the confluence of a housing crisis and exploding costs of living. Change the slide, please. We're also, calls are getting, and just a couple of other things. Calls are getting increasingly, in our experience in the last few years, more emotional and more urgent as well. And we are absolutely experiencing more calls involving mental health needs for seniors, as well as those who care for seniors. In terms of contact methods, in terms of contacting us, This is a direct reflection of changes that have happened in technology. Yvonne talked a lot about the phone, but in addition to that, although that is still very significant for us, and we still have our toll-free phone line, and we still receive a lot of calls on that. But we also are getting requests through our website, through email, through text. That can be challenging. Social media, a lot of social media reaches as well. And we're experiencing more and more resources, gathering more information on resources, online and offline resources. And they can be global, they can be local. And one of the other things that we're finding is that those resources are themselves adapting rapidly to changing environments as well, which means that we also make those changes. And there's something that we call the category of needs. And category of needs is essentially when someone calls, what is the need that they are expressing? We create categories from those needs that also then have a bunch of resources within the context of that to satisfy those needs. I hope that was clear. And those category of needs of seniors and others who call us are also rapidly changing and adapting. And I just realized I wasn't even looking at the camera. Change the slide, please. So I had mentioned about a chart that was going to, hang on one second, I'm going to bring that up on mine. So this is a chart that takes us from 1990 to 2024. It's the number of referrals to the organization during that 34-year period of time. And back in 1990, it was around 1,000 referrals for that year, up to 5,000 now, 34 years later. So the growth has been rapid, but within the context of the growth of the referrals, there has been all of those other changes that we just talked about as well. Could you change the slide, please? The other thing I referenced is a pie chart that's highlighting the category of needs. So when I talk about category of needs, that was that when people call us, they will fall within a category of need based on what the conversation is that's going on. We then create categories of those needs. So for example, on this chart, and I hope it's legible for you, this chart references for this last fiscal for the organization, there were the quote unquote top 5 categories of needs. Number 1 was housing, and that's not surprising considering the number of evictions that are happening, the cost of apartments for people. So 19% of all referrals were based on housing. The second one was daily living. Now, daily living is a bit of a wild one because it can have everything to do with snow clearing, anything that requires you to be able to stay in your own home. So that could be in terms of referrals, at home foot care. We have a number of lists for foot care, for snow clearing, etc. That could be an emergency alert system. It could be house cleaning that you require because you need help with that. It could be adult day programs, accessible transportation for medical transportation, and a myriad of other category of needs within the need for daily living. Taxes is one moment in time, and yet it's 11% of our category of needs, along with financial, tying up with financial. And then finally, health. So a few years ago, it would have been health, very near the top. Housing is always pretty close there with financial, but health has come down as a percentage. And very quickly, some other categories of needs that we have include issues and advocacy, leisure, which is a vital part of things for seniors with regards to social isolation and its relationship with dementia. There's government benefits, which are very significant. Yvonne talked about elder and domestic abuse and legal as well. So those are just some examples. Could you change? Thank you very much. So as I mentioned, over the last couple of years, There has been an emphasis on the affordability of housing, food, heat, and energy. We got a lot of calls for people looking how they're going to get their power paid. Homelessness has unfortunately taken hold. I recall the first time I ever had to say in the last few years to a senior who was being evicted that there was a good possibility that you were going to end up in a shelter, a word that they had never heard before. And the reality of shelter for seniors, particularly with health conditions, meant that hospitals became shelters, and there were seniors lined up in hospitals having gone from the shelter. And we have dealt with many seniors who have been living or probably still living in tents and trailers. So we're hoping to see the backside of this one pretty quickly. And the other part of the thing that is relatively new for us is that then we find ourselves playing a more active role with seniors in terms of helping them, not just giving them a referral, but actually having to help them through, because they're navigating things that they've never navigated before. The residential tenancy boards, the hearings, the sheriff of the high office or something like that. And so there's an increased need for navigating with them through some of those things. Next slide, please. At the beginning, Trudy referred to some of our programs, so I'm going to share with you one that recently clued up, and it's called the Pan-Canadian Project Collective Impact. And essentially, when we work very closely with our colleagues where seniors have complex needs, and we know that there's a few that all of us end up kind of touching on or whatever, sometimes there's a lot of cracks in the sidewalk when multiple people are trying to help one person, particularly over the phone. Maybe there's some communication challenges, and it's probably a very complex situation. So this Pan-Canadian project called the Collective Impact was designed, I believe it ran for 4 or 5 years. And what it did was when a senior was identified having complex needs, we were able to bring together a team of professionals who were supporting that senior and others who possibly could help support that senior. And that team would come together not very often, once or twice, but with the permission of the senior to gather all of the information that we could from each other, get together and meet together. We could literally change things in 2 meetings and get them back on track and where they needed to go. I don't know how many exactly we helped, but I've sat on many of those teams, and the power of being able to do it all together and remove most of the cracks in the sidewalk, having the right people there who have the right information, was life-changing for many, many seniors there. So we just meet a few times, identify and seal the cracks in their sidewalk and their support system, and they could take it from there. It's not to step in on them or it's to get them back on track so that they can take care of themselves. And the goal really of the organization was for us collectively to learn to think and act as one more effectively. So now that the program is over, hopefully many of us in organizations will change the way that we work together. Next slide, please. In terms of information referral, and then another thing that we do is bring awareness to and action on elder abuse through the organization's Newfoundland and Labrador Network for the Prevention of Elder Abuse. There's a membership for this organization and a steering committee that meets regularly, has had the opportunity to at least start and or make some significant changes as it relates to elder abuse in our province. We also are part of the larger national network on that as well. And by virtue of this, it allows us to identify and escalate systemic issues to the Office of the Seniors Advocate. And we're also not related to this, but we're also provincially connected as an organization with another organization called the Newfoundland and Labrador 50 Plus Federation. And this is a group of 130 plus seniors clubs across the province. Yes, 130. And we work very close with the Federation and other seniors groups in order to help communicate what they need, be a part of their activities, anything that they want. Is generally we're at their service. And then the next slide. So the peer support volunteers are an integral part of our success. They're vested, they're empathetic, and they are very professional. Many of our peer support volunteers have worked in organizations such as the CRA, Newfoundland and Labrador housing, et cetera, et cetera. So they bring that knowledge to the table when they're talking with seniors. And the resource database is a central tool for our information and referral database. Trudy, I believe that's over to you.
Yes, thank you so much, Meg. And really, it's the volunteers and the staff that are involved on the front line that really creates heart to this organization. We are a specialized INR, and as such, we have a specialized INR database. Next slide, please. We are involved with Inform Canada. We've been involved since 2016. And we also receive support and training from Inform USA, things like standards, help with doing policies, training. We do have a person who has certification, myself, database curator, and we have a couple of staff and volunteers that are working on certification. So thank you so much, Inform Canada. Go ahead. And just looking at some of the Inform USA standards, certainly the first one that talks about a specialized INR indicates that we should be involved in identifying community INR needs. And as you can probably imagine, that has been an organic experience from the very beginning. Our INR database was almost 100% first when we started. We have started to add more things in terms of being more consistent. For example, if you have in Western region an audiologist or a program under the Western zone, we're going to add it to Labrador Grenfell, for example. We also, under 12.1, we are certainly involved in maintaining current information about other INR services and their activities, such as 211NL, and certainly with other programs as well and organizations. Next slide. So to continue on with the standards theme, so when specialized and comprehensive INR services overlap, we definitely work to coordinate the service delivery with other programs to avoid duplication of efforts. And we have certainly documented relationships in written agreements. Next slide. And we will talk to you a little bit about how we've been involved with 211 and Find Help in that regard. In 2016, Elizabeth Siegel was involved with creating a customizable database, and it was based on 50 plus programs and services in Newfoundland and Labrador for people who are 50 plus. Our database is different from many 211s. We do have a lot more, probably more internal notes for navigators, how to use this entry, how to communicate certain things to the caller, how to discuss some things to add to let them know, how to talk about how to increase access, as Yvonne was talking about, and Meg, there are definitely more online services for seniors, and certainly organizations and departments have put in ways for seniors to access it but it is increasingly people that call us are not using email, or they cannot, or they don't have access. So it's very important that they have a way to be able to access services that they need. We also have frequently asked questions like, can I own my own home if I need to go in a long-term care facility? We have contacts that are used for administrative use, for situations where it's a complex situation and we need to contact somebody with CRA. We also can have attachments, and we certainly use that quite a bit. Go ahead, next slide. We do have, like your traditional agency program sites, around 1,200. We are certainly looking to purge. I don't know if you've seen that Inform USA session on purge. Definitely we need to. And it's because we have to add more. And I will tell you a bit about that later on. So, but we also have about 100 agencies that are lists. And those are businesses. Often there's no program. Sometimes there are sites, but often not. And there's a list of businesses that provide odd jobs or lawn care or snow clearing or foot care. And these are very important. For example, people are calling, yes, they're going to have to pay, but it does make a big difference to their lives in terms of daily living and staying where they want to live. Next slide. So just to talk a bit about, and this is again, AIR's conference title was The Eye of INR, and we do have a lot of information. Our guide has been parked for a while, but we definitely do have about 30 SeniorsNL generated materials. A lot of them are lists, like a list of long-term care homes in Western NL, or a list of personal care homes in Western NL. We also have places that people can contact in terms of looking for housing. We have guides, brochures. For example, we have a quick guide to social and recreational activities in St. John's, and also working on one in Cornerborough. We have other other types as well, types of programs as well. So we also have a SeniorsNL website, which we're working on, and we have all other social media as well, such as Facebook, that sort of thing. Next slide. So successful partnerships do not just happen. We really do have to work on them. We have to be aware. And it's very important to have very good partnerships to really reach your mandate, any organization. So for us, we accomplish our mandate through outreach and partnerships with older adults themselves, family members, volunteers, seniors groups, organizations, businesses, communities, INR organizations, and all levels of government. And that includes like funding agencies, businesses that provide money, individuals who provide funding to us as well. Go ahead. So just to talk about our experience with 211 and Find Help, it started in March 2021, and the provincial government provided money to it was called Food First NL. And there was a bunch of us that partnered with them, and they created a provincial food helpline. Now, right now, 211 has the meals and the food banks, those such things. They take care of that right now. But we continued on, and we, SeniorsNL and 211 and Find Help, developed data sharing of those and other resources and categories. And we hope this year that we're going to continue to strengthen our relationships and to streamline our resource management efforts. We share about 40 to 50% overlap. That may change, and I'll explain in a minute why that will. But I really would like to thank 211 NL, Find Help, and United Way and their staff for their sharing of support and expertise with us. It has been very, very helpful to me, certainly, as well as our organization. Next slide. So I just wanted to talk to you a bit about another program that we have. And I know you have a session yesterday on social prescribing. Our SeniorsNL and our NL Health Services, which is our provincial health authority now, have integrated social prescribing into the healthcare system. So patients of family care teams that are 50 plus have access to link workers via referral. These link workers are our staff. So SeniorsNL provides training, day-to-day support for the link workers, and the link workers also will work with us to build our resources, our resource database for this area in Newfoundland and Labrador. And so we will increase our, for example, we're working with Claremont now. In the Claremont area, we will increase our resources in that area. Next slide. So our management team includes myself, you met Susan, we have the other link workers, and also the peer support volunteers are involved, Meg and other staff, and of course Sherry, who is involved as a verifier researcher for 2 days a week as well. So there's 2.5 staff. I hate to call Sherry a hack, but 2.5 staff, I guess HR positions involved right now. Next slide. And I thank you so much to listening to our story of the journey of our information line and more on SeniorsNL. Thank you.
Thank you, Trudy, and thank you to the team. I wonder if any of your team have anything that they want to add or any comments. And of course, people viewing, please add your comments or questions to the chat.
Meg and Yvonne, if you wanted to turn on your cameras.
This is Michelle. I have a question just to start us off. You sort of went around this, but you didn't say exactly. I take it that you are talking about, you are defining seniors as 55 plus, but you're giving some room around that for anybody who calls you, you will help them. You know, how does that work for your team?
I'll just start, and then Yvonne probably has a bunch of things to say, but the database is specific to look for resources for people who are 50 plus. So beyond that, obviously, if someone calls and they're 30 and they're looking for information on reproductive rights and things, we're going to send them to 211, of course. And if someone calls around food bank issues, generally we're going to refer them to 211. So it's, you know, in St. John's with delivery, there's a bit of a difference there. But yeah, so we do our database and our service. It is, you know, 50 plus. However, I'll give it to Yvonne to talk about the pieces in between.
Well, we don't ask people how old they are. We just listen and wait and find out what they need, and then you can refer anybody. But if it's where you're referring them, if that organization has a age restriction, then you kind of warn them, and they decide whether they fit into that category or not. So it's up to them. So that's how you get around that. You don't just ask. I personally don't ask anybody what their age is. But when you're talking to them, they usually come out, and you'll find out. So you don't have to ask that question. But sometimes, as I say, you do need to know in order to refer them, because you don't want to refer them somebody that wouldn't help. But you can't guess by hearing their voice. So you have to get it through a conversation.
Very true. Thank you. And the other thing I guess I would like to know is, you know, you've talked about your social prescribing, and I did hear the session that we had yesterday, and I just wondered, you know, how much uptake have you had on that? And is it something that's broadly, I mean, I know you know about it. Is it broadly known? And, you know, how's the uptake been on social prescribing in Newfoundland and Labrador?
Would you like me to answer that, Trudy? Okay, I'm actually here in Toronto. My name is Kimberly Leonard. I'm the CEO of SeniorsNL, just joined in August. I'm part of this social prescribing project, and we're actually here in Toronto presenting on that as we speak. It's being well received in Newfoundland and Labrador. We are at the stage where just 1 year into the project, and we already have link workers in various zones across Newfoundland and Labrador. And we are actually at the stage where they are actually taking intakes and referrals at the present time. And we are getting positive feedback from the physicians and the social workers and the professionals within the healthcare system, saying that it's very positive. I know there's a long ways to go with this, but as you know, at the end of year one, it looks very promising and moving forward, and it does across Canada.
Thank you, Kimberly. I'm inviting people to, we seem to have a very quiet group this year at the symposium, but I'm inviting people in the audience. Please chat your questions or comments.
Very quiet.
They are a quiet bunch. Well, I'm not seeing or hearing any further questions or comments. Thank you so much, everyone from SeniorsNL, Kimberly Leonard, Meg Viz, Susan Roche, Trudy Marshall, Yvonne Jacobs. Thank you very much for your very deep dive into where you've come from and where you are and where you're going. Thank you so much for being with us at the Inform Canada Symposium. Really appreciate your presentation. Thank you.
Thank you.